Afghanistan, a Public Health Survey by Elise Hyan. Afghanistan is located in the World Health Organization's Eastern Mediterranean region and has a population of about 31 million people. It is a landlocked country surrounded by Pakistan, Iran, Turkmenistan, Uzbekistan, and Tajikistan. 7 major ethnic groups and several other smaller ones reside in the country. Islam is the religion of Afghanistan and is ruled under the Islamic holy law, Sharia law. The overwhelming majority of the Afghan population resides in rural areas, with only 24% living in urban areas. There are 34 different provinces in the country. A picture of the public health situation in Afghanistan would be severely underinformed and lacking without an understanding of the country's tumultuous history. Governmental instability, foreign occupation, and civil war led to anarchy and a destructive string of civil wars almost continuously from 1919 to 1996. In 1996, the capital, Kabul, fell to the extremist Pakistani group, the Taliban. The Taliban's oppressive and religiously fundamental rule caused dire underdevelopment, human rights abuses, and ongoing conflict across the country. U.S. and other allied forces occupied Afghanistan after the September 11 attacks and overthrew the Taliban. Political reconstruction efforts have been made towards governmental stability since then, but continuous war and civil conflict for the past few decades have had an unimaginable toll on the people of Afghanistan and adversely affected all areas of development, and Afghanistan is still recovering. War and conflict destroys infrastructure and economy, displaces people, and halts all development. The health status and key health indicators aptly reflect the instability and underdevelopment of Afghanistan. According to the UN Development Program, the country illustrates the devastating impact of decades of war and conflict on development. Now for the health status report. Total mortality from infectious and parasitic diseases is 722 per 100,000 population. The leading causes of morbidity and mortality are as follows, with maternal causes being the biggest, followed by tuberculosis, diarrheal diseases, acute respiratory illnesses. Leishmaniasis is the most common neglected tropical disease in the country, with an incidence of over 200,000 cases and around 13 million people at risk. Next is the Women's Health Status Report. The fertility rate in Afghanistan is 6.2 children per woman. The global average is 2.4. The maternal mortality rate per 100,000 live births is 460. The global average is 210. Female adult mortality rate is 245 per 1,000. These are all really high compared to the rest of the world and the region. Maternal-related causes are the major causes of the high mortality rates in women. Family planning methods and contraceptives are not widely used here, and only 36% of births are attended by skilled health personnel. Only 15% of mothers and infants receive sufficient antenatal care coverage. Gender disparities exist in healthcare due to the long-standing traditional gender inequality in Afghanistan. Women cannot visit health facilities and discuss their complications with doctors. They are often not aware of good hygiene practices. Many pregnant women do not go to hospitals, and many women lack the power to take family planning measures. Next is children's health. The chief indicator of any population's overall health status commonly used in global health is infant mortality rate, and Afghanistan has the highest in the world at 119 deaths per 1,000 live births. The under 5 mortality rate is 101 per 1,000 live births, and the neonatal mortality rate is 36 per 1,000 live births, both very high compared to the regional and global averages, almost twice that. Most important causes of morbidity and mortality for infants and children are diarrheal diseases, acute respiratory infection, and prematurity. There's a need for clean water and sanitation, improvements in healthcare and access, women's and maternal health, education, and in maternal and child nutrition. According to the Millennium Development Goals Annual Progress Report in 2008, Afghanistan is a couple years behind schedule on each of the goals, with only goals number 2 and number 8 being on track to complete. Though poor health status, poverty, and hunger plague the country, Afghans define lack of peace and security as the country's largest problem, so a 9th MDG was added, enhanced security, and this plays a crucial role in achieving all the other MDGs, especially in regards to Afghanistan and their current conflicts. Key social determinants of health in Afghanistan. First, lack of education, especially for women. Also, urban versus rural living situations. There's a large disparity between urban and rural areas in receiving health care and adequate water and sanitation. Next is the gender inequality. This is a socio-cultural reality in Afghanistan due to the Taliban's presence and religious tradition, and this has led to huge health disparities between genders and a lack of women's rights. There's also a lack of peace and security and ongoing conflict in the region that determines the health status. There's also a high number of displaced persons due to the conflict, a high rate of opium addiction and a growing drug trade, and extreme poverty. Almost 40% of the population lives below the poverty line. Overall, the health status in Afghanistan is dismal. The population is in need of immediate relief and development. However, the health status has greatly improved over the last 2 decades and is continuing to do so.